this is an interesting topic, and it pretty much, extends from the earlier conversation that we had with Dr. Pandekar as well. So I'm just going to kick off by asking you, Dr. Riker, because, we are talking about an age where digital health is actually a priority now, artificial intelligence in different forms and manners in medicine, whether it's surgery, whether it's diagnostics, it's sort of omnipresent at this point. What has your experience been from a government perspective when it comes to artificial intelligence and healthcare?
Thank you for inviting me. Goa is one of the innovative states with regards to the artificial intelligence and digital health. The fewer initiatives which government of Goa has taken is about integrating ABDM, that is Ayushman Bharat Digital Health Mission, and HMIS in the public health sector. As you initially mentioned, Goa was the first state in the public health sector, and that too in primary health center Kholim, we had initiated this program wherein we had demonstrated HMIS at the level of primary health care. So with regards to ABDM and HMIS, it's beneficial for win-win situation for the patient, the caregiver, and the caretaker also. The patients, yes, definitely. With regards to HMIS, we have seen patients at the primary health care, we have got around 10,000, 12,000 patients. Data is already gone digital. The retrospective data the patients can retrieve. In case a patient is getting referred to the higher centers with regards to the cross referrals, the patient again gets benefited at that level. With regards to the state level and these things, as a policymaker, we know in which direction we are going. What's the trend of diseases which we are looking at, and what interventions are required at what level. So that is one of the things. Our Honorable Health Minister, has taken few of the initiatives with regards to other initiatives which we have taken, which was one of them was STEMI. That is the heart attack project, wherein we have got a patient coming to a primary health care. That is one of the examples which the whole of the nation is looking at, and many of the states are replicating this project.
Can you tell us more about this?
Yes, with regards to STEMI, we started in the year 2018 across 20 health facilities at the primary health care. Goa has got a coastline of around 3,000 odd, and we have got around 25 primary health centers, rural medical dispensaries, CHCs. But starting a patient treatment at the PHC level with regards to a patient who is having heart attack comes to a PHC. Once the patient comes to a PHC, there's something called tele-ECG, wherein electronically and to digital system, the report goes to the central base, which is based in Bangalore. And again, within a minute, we get a report whether the patient is having a heart attack or a MI, that is ST elevation MI. Within a minute, we thrombolize. One of the best initiatives which Goa government is doing is we are spending around 34 to 35,000 for a drug which is called tenecteplase or retiplase at the level of PHC. And once the patient has been stabilized, we refer the patients to the hub center. It could be a JMC or any of the private hospital which has got a DDSY scheme. And the patient is further interventions with regards to PCI intervention has been taken care. So many of the states at the national level, at the ministry level, had visited to Goa. And this is getting replicated at the national level.
Okay, so just on this cardiac project that you spoke about, if you could just give us a sense in terms of how successful has it been? How much have cardiac cases fallen by, or with regards to this early intervention,
yes,
or the fatality or mortality rate?
Yes, so we started this in 2008, I mentioned, and for last, say, 5 or 6 years, we have thrombolized more than 5,500 patients at the PHC level. So you can imagine how many lives have been survived over the last 5 to 7 years. So 5,500 is a big number at the PHC level. And so further on evaluation, basically life-saving technology is used at the PHC level, which is getting replicated at the national level. Okay.
And the primary care center that you all have set up, how exactly does that work?
It's the same model all across India, wherein any of the patients which comes to a PHC level, we have got a tele-ECG machine at the level of PHC. When the patient walks with any chest discomfort, the MBBS doctors or the staff nurse takes the ECG. Once the ECG is taken, the ECG is sent to a central base command center wherein it is read. And again, the same ECG goes to GMC when the cardiologist reads. So there's a double check which happens whether the patient is having a myocardial infarction or a heart attack. Once that is done, the patient is immediately, injections are given at the level of PHC, and we have got advanced life support ambulances which are present at the level of PHC. That's how we transfer the patient to GMC for further evaluation and management.
And this is all being read by a machine in Bangalore in terms of the accuracy?
It is read by the machines, the normal reports are discarded, and it is cross-checked at the higher levels by the cardiologist or the other doctors who can read the ECGs. And then immediately in a minute, the report has been submitted to the respective health centers.
Okay, all right. Dr. Srivastav, you're in the thick of things. Give us a sense in terms of how much artificial intelligence has helped in terms of early intervention when it comes to when it comes to cardiac events, when it comes to strokes, when it comes to early diagnosis.
So, Ekta, thank you very much. I owe my allegiance to CNN News 18 and this conclave we are shot, and my friends in the audience. It is a wrong question to a surgeon, but however, I will try to simplify it. A surgeon talking about cardiological intervention is like, as he has said, my previous speaker told, the interpretation of the cardiological parameters are the basis of treating the cardiac cases. And interpretation, as he said, that the normal reports are discarded then and there. And the abnormality in the reports are taken to a higher level, maybe a referral center. And then from there starts the ball rolling, and it goes to the specialist, and then the specialist keep caring, and thrombolization at a primary level. I congratulate you and feel envious because I come from Jharkhand and the facilities are too meager. The population is as much as 3.3 crores compared to the Goa's population, although we are the richest mineral state in the country, but not to say our public, our fellow state citizens, they are suffering a lot. But we will take a clue from your cardiac program, and this is what I have to say as a generalist for the cardiac cases, and you will be more particular for the surgical issues than I will. More
yes, I'll get to that. I want to know your experience in terms of surgery, because we already had Dr. Bandekar talk about a lot of
he
success.
simplified our life. And your discussion with him already has made our lives, the later speakers who are from the surgical fraternity, a very comfortable one. So in surgery, you have already mentioned about robotic surgery. First thing, Ekta, I'm very particular about coining the words. So whenever it comes to robotic or laparoscopic, I mean adjectives, I always hate it. A surgeon can be a laparoscopy surgeon because he or she uses laparoscopy tools to do the surgery. So, and similarly, robotic surgery itself tells that, okay, the surgery is being done by the robo. It is robo-assisted surgery. The surgeon is still there in the helm of affairs. And surgeon may be sitting on the console, and his arms will be the robo arms in the operation theater, and he's monitoring his maneuvering from his console. So it is a robo-assisted surgery. The first thing I like my friends in the crowd to share and dissipate this concept that it is not robotic surgery, it is a robo-assisted surgery. And
will it ever be a robotic surgery?
Uh-huh.
Will it ever be an entirely robotic surgery?
Entirely robotic surgery is a dream, is an imagination. It is there, but tell me, Ekta, if it comes to me, and if it says that, okay, you will be operated by a surgeon sitting across all the 7 seas, and he will be operating you through the internet connection and the robo, I'll be the first person to say no. Because we need a human touch. So unless until there is a human being on the console in near vicinity, I don't think I'm going to subject myself, or even I will advise you not to subject yourself to machine surgery. It is just like that Tesla came, automated car. I was in US, and then I was taking a stock of the situation. How many of you, I just asked erratically. How many of you want to be driven in the Tesla auto-driven? In the crowd, people said, hardly 5 to 10% people said, okay, I'll take a chance. They said the statement, I'll take a chance. So in surgery, my friends will agree and my friends in the crowd will also agree, you don't take a chance. It is this way or the other way around.
Sure. Dr. Netalkar, I'm going to toss that over to you, considering that you're in neurosurgery. So give us a sense in terms of artificial intelligence used within that field and in your practice as well.
Yeah, thanks very much for calling me. As far as the artificial intelligence concerned, all over India, it's very infantile stages as such. Just using robo and VR or AR assisted technique is not much of artificial intelligence where the people are benefited. Ground level people will be benefited if there is a diagnosis which is done quickly and in rural areas, particularly in India. And how this totally is possible only if you are digitizing the data. We have absolutely close to zero digitization of the data in most of the government hospitals. There is about 20 to 30% of digitization happening in the private hospital. When I was in UK, it was in 2000, the digitization has started. In Hinduja, PD Hinduja, it started in 91, 92. So this digitization is absolutely important for putting all the data together.
That's where it can really help. But in neurosurgery specifically, how is artificial intelligence helping? Is it a part of the surgeon's table?
Absolutely. Neurosurgery is the number one branch where it can help, and it has helped all over the world. I'm not talking of India, but the rest of the world. Neurosurgery, we need to approach, first of all, brain is hardly a small organ, and in that a small tumor, you can be lost. The artificial intelligence can exactly tell you which way to go, how to go, and it will tell you if there are vessels behind the tumor which you cannot see. So if you pull on the tumor and there's a vessel going to your language area, your language will be gone that very moment. So in neurosurgery particularly, lot of digital evolution has happened in the last 10 years, and it has really revolutionized neurosurgery.
Is it being used in India?
It has been, India is last 2-3 years, there is a government backing. There are about 10,500 crores sanctioned, and out of which 300 CR has gone to All India Institute. HCPGI Lucknow is the premier institute where even I talked to the director there yesterday, he wasn't aware of much. So it is a very, very beginning stage, and it will take not less than 10 to 15 years going forward for much things to happen.
What is the accuracy outcome when it comes to using artificial intelligence in neurosurgery?
As in anything, accuracy will come only with a correct input that is given to the computer. If you put junk in, you will get the junk out. Okay? So our data input has to be very, very reliable. Otherwise, going into one area, you will go within a millimeter. If you deviate in brain, you will go into a disaster. So that is where accuracy of the data, with the data accuracy, it is almost 100%. Like a surgeon, maybe 60%, this will be 100%. Yeah, like a CT, MRI, now it takes not more than 3 seconds for CT, MRI to give you the full report, and including your history, past history, and prognostication, whether you need surgery or you can be treated conservatively. That much is the advance in neurosurgery. Okay. It can predict the intracranial pressure, whether it will go up in next half an hour or 45 minutes. You can ask the operation theater to be ready. As there are some neurologists here, it is of great help in stroke prevention. If you are whether to do thrombectomy or TPA, or only TPA. It will tell you 1 hour in advance whether this particular infarct needs to be operated, done TPA or thrombectomy, what are the results, whether there is a transient ischemic attack, developing stroke, whether it needs anticoagulation or not. All that will be told by the...
So in a way, it actually gives relief to patients or prospective patients that say, for example, God forbid, somebody does have a brain tumor. It used to almost be a death sentence earlier. But with artificial intelligence, there is almost there's a chance of 100% successful outcome. And hence, training is possibly the only, hurdle we need to get through.
Yeah, as I told you, the training in all surgical branches, 80% should be basic training. You do not go to a medical college to get trained into the robotics. Robotics is highly advanced. You must be able to operate any patient without help of any of this, because anything can go wrong anywhere, as we know. Electronic data can be unreliable and failures of machine can happen. So 80 to 90% training should be finished in your training area, and maybe 10-15% you polish yourself with robotics.
Okay.
Yeah.
Dr. Vankadev, you have actually, my lab rather, has been really put on the Indian map because of your advancement during COVID, where you all made the indigenous COVID test, and that too in the span of 6 weeks. If you had to make that test today in the span of 6 weeks, how will artificial intelligence aid as compared to 2020?
Good evening. First of all, thanks for the invite. I think that's a wonderful question. 5 years seems like a small time, but the way AI has evolved, especially in diagnostics, I think it's much more faster as compared to maybe interventional surgery and other things. The reason for that being, diagnostics is something which needs to be decentralized. It needs to go to the rural areas as soon as possible. Now, if we had to make, coming back to your question, if we had to make the same test now, I will put a lot of things like, reading the test automatically. At that point of time, we require a molecular biologist to read the graph, to see the PCR curve, whether it was beyond a certain limit. I think within a matter of not even 5 years, within a year of that, we had wonderful tools which were able to tell what is your level of COVID, what is the trend of COVID, and all that developed within 1 or 2 years. So yes, if we were to develop that test now, it will be much more easier, much more faster to interpret, and digitally connected. So authorities will get to know the results straight away.
What are you all doing today when it comes to artificial intelligence? What's your pipeline of products and how are you all using it?
So something very interesting happened right during the COVID phase. So apart from the PCR test that we developed, we also developed the COVID self-antigen test by the name of COVID Self, if you heard about that. Now, one major challenge that we were getting from the authorities, from the regulatory bodies was, how does a patient or a person himself interpret that test? And that was perhaps the first time we used artificial intelligence in diagnosis. So a person could click a photo of that rapid test, and the phone with the app inside it could interpret the result. In fact, we took it one level further. In fact, ICMR took it one level further, wherein the result was automatically then pushed to the ICMR portal. And a very interesting episode that came out of that was when our software team was developing this, and first time when we connected our test kit to ICMR portal, he was testing it in the office. He just clicked a photo. Within a minute, he got a call from the local district hospital saying that someone is positive in that region. So ask that person to quarantine himself or herself. So that is the power of AI and digital connectivity. So yeah, that's how we've evolved.
So COVID, thankfully, is over, and hopefully we don't see a repeat of it. Say we are talking about a world without COVID. How exactly are the two coming together now in terms of home testing as well as artificial intelligence? Is it being used for other diseases, other comorbidities?
Yes, so home testing is growing fast. In fact, US FDA has been fairly lenient. It's a very stringent body, but it has approved certain home testing kit even for critical tests like HIV, hepatitis. So people can then use saliva or even blood and do the way testing is done for glucose at home. As far as other things is concerned, one place where artificial intelligence has grown leaps and bounds is diagnostic radiology. So I'm not saying they're completely ruling out the need of a radiologist, But a lot of inputs, a lot of result interpretation can be done with the help of AI. In fact, Goa has been leading this by, sir would know that, by having the cancer screening done using AI. That's an amazing step. So that's how AI is growing. So we're trying to decentralize, offer the same test which was only available to a primary, in the tertiary centers. Now the same tests can be done even in rural areas and at home as well.
Okay. Just a quick question, and I asked Dr. Bandekar that as well, that if in case there is a conundrum where a radiologist has a differing opinion from what the artificial intelligence interpretation of a particular scan or biopsy or whatever it is, what would consensus go with? Whereas, the human consensus is not a part of it. It's just what would consensus go with in that?
I would at still stage, as a doctor, I would still back the radiologist, because ultimately what the machine or the software is telling us is based on the data we've given it. So we've maybe given it 100,000 different types of radiologies, and based on that it has come out with an algorithm. But nothing can actually replace the actual human correlating it with, even the position of the patient, the clinical history of the patient, and giving a result.
So are we talking about this kind of backing even 10 to 15 years down the line, where artificial intelligence will probably be even more integrated into medicine?
Definitely. So as and when we get more data, we get more confidence, some things may be completely off the list of a doctor's to-do job on a daily basis. But to begin with, let's take it one step at a time. Let's take the easier things first, and probably something more complicated can come in later.
Okay. I just want to acknowledge that the Health Minister has now kindly joined us in this event. Thank you, sir, for joining in. Well, if we could just continue, and I'm going to come back to you, Dr. Raikar, because we are talking about the initiatives that the Goa government has undertaken when it comes to health, and we do have the Health Minister with us as well, the Honorable Health Minister. Dr. Raikar, give us a sense in terms of how the government is undertaking initiatives when it comes to oncology, and how is that sort of helping in terms of preventive testing, because India actually has one of the largest oncology burdens in the world right now.
Yeah. We have a Honorable Health Minister here. Because of his initiatives, we have got a lot of innovations in the state of Goa. With regards to your oncology question, yeah, on an average, Goa looks at a number of around 1,500 cases of cancers in Goa. It could be cervical, oral. As per the ministry's guidelines, we have to do screening for oral, breast and cervical cancer. But a couple of initiatives which our Honorable Health Minister has brought in Goa is, one is breast cancer screening, wherein iBreast machine is used at the level of community level. It's not even at the primary health center level. Once you go to any village or a community, we have got a small handheld device wherein we can go in the field and do the iBreast screening. And again, it's connected to the cloud, and where within, say, 2 to 3 minutes, we get the report. It could be suspected tumor or any other lump in this, and then further evaluation of management of patients can happen. So till now, we have done around 177,000 or 78,000. And in the field, in the village level, at the grassroots level, we have diagnosed around 77 breast cancer positives, and then the patient has been taken up the higher centers. Second initiative which Sir has again taken up in Goa is about the lung cancer screening, which is again the initiatives by the government of Goa, wherein a patient is at the primary health center level. Most of the health facilities have got digital x-rays. Once the digital x-rays are connected to again a AI-based system, that is QRI, which is again in partnership with QRI and AstraZeneca, these patients are screened, and then once in case there is some high density lymph nodes or anything that can be identified for the patients are referred. So through this mechanism, we have diagnosed around 7 lung cancer patients in Goa at the level of primary health centers. Wow. That's another initiative, and I think we should definitely applaud, because this is why all the initiatives done by the Honorable Health Minister.
Absolutely. Well, on that positive note, thank you, gentlemen, for joining in and giving us your perspective on how the digital era is moving forward when it comes to healthcare.
Ekta, I think before we conclude,
Sure.
AI should be pushed in more for the curricula.
Sure.
The AI has to be the challenge given to the National Medical Commission and the medical curricula, because unless until the students, the young minds are trained in AI, we are not going to reap the harvest.
Sure, absolutely. That point is taken. Thank you very much for joining in.